Hi, I'm Dr. Stan Steindl. Welcome to Compassion in a T-shirt. Today I'll be diving into Schema Therapy and just where compassion and self-compassion might fit in. I'll be speaking with Shay Addison and Dr. Lars Madsen. Shay is psychologist and director of Forensic and Clinical Psychology Centre here in Brisbane, Australia. She's been a psychologist for over 20 years, working in custodial and community-based corrections, especially taking a schema therapy approach to her work. Lars is clinical director of Forensic and Clinical Psychology Centre. He's an industry leader in forensic psychology, bringing schema therapy to his work with forensic populations, including as a therapist, supervisor and trainer. Shay and Lars, along with Dr. Rob Brockman, have a wonderful podcast called Beyond the Crime, a psychological analysis. I've already binged the first 5 episodes, and the 6th episode is coming soon. We have a wide-ranging conversation, not least what is schema therapy, where do compassion and self-compassion fit in, and what are some of the similarities or differences between schema therapy and compassion-focused therapy, not least with forensic populations. And some of the similarities and differences may surprise you. A great conversation. And so I give you Shay Addison and Dr. Lars Madsen. Shay Addison and Lars Madsen. We just had a hilarious mix-up. I forgot to press record. Now it's recording. So thank you for your patience. And I'm just excited and delighted to get a chance to speak with you both. I have had a little bit of training in and around schema-focused therapy, but I'm really interested to think about the way that schema-focused therapy and compassion-focused therapy might be similar or different, or perhaps even integrated. I'm curious about things like the where compassion might fit in to the schema model, and also the idea of the compassionate self that we talk about in CFT. But welcome to Compassion in a T-shirt.
Thank you very much, Stan, and thank you for having us on board. I'm obviously we've known each other for many years. Stan, I think you're ahead of me in clinical school. I think you were the year ahead of me, but we ended up being on the same touch football team, I think, for a period of time.
Oh, yes, gosh, I'd forgotten about that.
I mean, that's
oh my gosh, I
it's
think
about 25 years ago, is it?
Was that at UQ? I might have even come and watched a game or two. Goodness me.
Oh, that might have been in those early stages. No, that's right. I think we're sort of we've had parallel careers in a way, and so that's been really cool. But I wondered whether we could start with a bit of a primer.
Yes.
On schema therapy. Perhaps, Lars, could you give us a bit of a primer on schema therapy and what that's all about?
Absolutely. So schema therapy is, in some senses, a relatively new kind of therapy. And when I say that, it sort of emerged in the 1990s from CBT, and it came about partly because many of the clients that were getting CBT therapy weren't benefiting from it. So Jeffrey Young and his colleagues back then started to look at different ways of trying to work with these kinds of clients. And these were usually clients who presented with long-term chronic and enduring issues and problems. They would probably be considered or evaluated as having personality disorder. And what they did back then is that they started to look at other kinds of psychotherapies and integrated concepts and ideas from things like Gestalt therapy and interpersonal therapy and psychodynamic types of therapies as a way of trying to work with and make sense of clients who were struggling with these kinds of issues. Now, one of the underlying theories or premises of schema therapy is this idea of core emotional needs. So there are 5 core emotional needs that we say people have. So these needs are safety, secure attachment to others, so safety, stability, nurturance, and acceptance, autonomy and competency, and a sense of identity, freedom to express their valid needs and emotions, spontaneity and play, and realistic limits and self-control. And these needs sort of are relevant in children growing up. At different stages, probably they're more relevant. Like it's perhaps obvious to say that secure attachments and stability is very, very important for children, for people very, very early on. And what we say, and what we say is it's important to have these emotional needs met at these times. And if people get them met more or less, not perfectly, but good enough, then people end up being able to have, you know, a stable inner world and cope reasonably well. But when they don't get met for whatever reason, then what happens is that people develop what we call as schemas. Now, schemas is another term for perhaps an emotional wound. I use the term sometimes with clients as a tripwire or a landmine. And using that kind of terminology is really to sort of try to capture the experience that clients have when a schema is activated within themselves. It feels like a huge emotional reaction that just feels, in some cases, like an overreaction. So to give you an example, so say someone grew up in a household where they had 1 or 2 parents pass away or leave for whatever reason, and they might develop a schema known as abandonment. So this is a sense of anxiety and fear around the issue of abandonment. So when they get close to people, perhaps they will start to anticipate or expect or you know, believe that people are going to leave and people are going to abandon them. So this kind of anxiety in their day-to-day life now as an adult, maybe 20, 30, even 40 years later, is kind of linked to these sort of formative experiences in their childhood where they experienced this sense of abandonment, and this emotional need for safety, security, and connection was broken for whatever reason. And when it gets activated, it generates very powerful negative emotion, and you know, and people try to cope with it. Now, the other concept, so there's 2 concepts now: emotional needs and schemas. But the third concept, which is really important and different for schema therapy and unique to schema therapy, is the idea of maladaptive coping modes. So maladaptive coping modes are the strategies that people early on in their life deploy as a way of regulating the distress that is caused by the activation of the schema. Okay, so there are different kinds of coping modes. So we have, for instance, we have what we call the child modes, and the child modes are referred to the child mode as in that's where we experience the pain of the schema. That's where we call them child modes, because, you know, that it reflects something of that's when that time, when that emotional wound kind of became relevant for someone usually. And then we have what we call avoidant coping modes. So these are modes that are predicated on really just trying to block feelings, you know, trying to cut off feelings, trying to not avoid feelings, cut off feelings, that kind of stuff. And we have, overcompensating modes. So overcompensating modes are different to avoidant modes, but they do the same thing, because it's all about not feeling, right? Feeling the pain anyway. And overcompensating modes seek to try to get on top of the emotion to overcompensate. Mm-hmm. So what happens when we see a client and we think of them as being appropriate for schema therapy, we would start to explore the problem they present with and see whether that is relevant for sort of longer term patterns in their life. So is this a theme in their life? Is this a long-term pattern? And is it just a repetitive pattern that keeps kind of reoccurring time and time again? And if we can start to see that, we start to try to look at, well, how can we understand this pattern using schemas and emotional needs by looking at that person's childhood in terms of what it was like? Did they get their needs met, or did they grow up in an environment where, for whatever reason, things didn't happen the way they should have? Right? Can we start to understand this issue from these concepts? And then we start to kind of, I guess, pull together a pattern and an understanding of the nature of their problem using the schemas, the emotional wounds, and the coping modes as a way of trying to understand the repetitive nature of what's causing them issues in their life.
Okay.
Now, I just like one of the key concepts, some of the key concepts that's really different about schema therapy to say CBT and maybe other kinds of psychotherapies is the importance that schema therapists place on the relationship with the client. So we have a very strong emphasis on connecting with the client and very strong emphasis on almost kind of forming what we describe or doing techniques described as sort of limited reparenting. So we, in a sense, start to work with the client and work with their emotional memories, trauma memories linked to the schemas, from a perspective of trying to help the client heal those schemas by being able to act as a parent-like figure to the client in our therapy in that time. It's called limited because it's obviously limited to the therapeutic context rather than, across the board. So they're some of the key important concepts. So, and I would see that the thread that links, I think, compassion-focused therapy with schema therapy is very much the value of the importance of compassion from the therapist with the client. Even if you're dealing with clients, as we'll talk about, I imagine today, about some of the forensic clients we have who are very powerful overcompensating modes. You have to have compassion for the client. You have to be able to kind of recognize that there is a traumatized part of them that sits underneath all these overcompensating modes. And also helping the client have compassion for themselves, right? So that's, very much a focus of our work with someone over the longer term is helping them be more gentle, be more compassionate, be more forgiving of themselves, so that they can themselves eventually work at trying to heal some of these schemas that might be relevant for them. So I've tried to get, so I apologize to anyone out there if this is a lot of information, but this is kind of, I think, a fairly brief, maybe comprehensive-ish.
Actually, no,
That's
that helps. That helps a lot, I think, and I like how you separated those three pieces: the unmet needs, the emotional wounds, the coping strategies. Shay, my understanding is that all of this moves towards the notion of the healthy adult kind of mode as well. That's something that arises from perhaps the therapeutic relationship, but also some of the strategies that are used there to develop, kind of this healthy adult mode. Could you tell us a little bit about that piece of the schema therapy approach?
Yeah, sure. That's probably the goal of schema therapy in a way is to have the best developed healthy adult you can have. And we use the language in schema therapy very much is about people having sides of themselves or parts of themselves. So all of these different modes of coping, including the healthy adult mode, are all parts. So people kind of understand themselves so they can flip between modes. And I don't know, when I'm working with clients, I always we do a mode map formulation, which is one of the first kind of things you work towards in schema therapy. And I always think of it, I try to figure out like how big is the healthy adult mode in comparison to other modes that they kind of function in. And I guess it's trying to help them have that part of them in the driver's seat, when they're acting or making decisions in their life. I suppose is the way I think about it. Working with my clients, that's the goal, because that's also the part that is compassionate to the vulnerable parts of themselves. And what you're trying to do with Lars mentioned before about the limited reparenting is trying to, as therapists, you kind of fill in that role a lot of the time when people first start, often, and the more traumatized people are, the more you need to do that. The goal over time is to help them develop their healthy adults so that they can then do that, perform that function themselves. And there are lots of things that get in the way, of people being able to do that. And not having compassion for themselves, interestingly, I would say, is one of the most difficult things, because there are these other modes which Lars hasn't mentioned, but they're parent modes. We call them in schema therapy. There's one called the critical parent mode and the demanding parent. And that critical parent mode is just so tough to so tough to deal with, really. It's like an internalized critic, which they've, kind of taken on board from parent figures that were too, not compassionate enough, didn't meet their needs. And the power of those modes can be quite sort of intense, I guess. And so compassion and helping that healthy adult connect compassionately with the vulnerable child part of themselves is a really big part of therapy. And
Yes, in CFT, in compassion focused therapy, we think of the compassionate self, I guess, which a little bit similar. It's kind of like a part of ourselves, or that sort of multiplicity of different selves that we might have, and there's the compassionate self. And a big part of the role, really, in some ways, of the compassionate self is to sort of bring awareness and understanding to those other parts that are really suffering. And sometimes to those other parts that we also, perhaps other parts of ourselves really hate those vulnerable parts, or there's self-loathing there, or there's shame, I suppose, is sort of the big piece of in all of that. And the critical self, which is a little bit like the critical parent, I guess, is very tough on the the sort of the more vulnerable parts. And then the compassionate self is trying to kind of, I guess, get in the driver's seat, as you say, and try to manage those different kind of interaction of the multiple selves. Does that sort of sound familiar there with the healthy adult mode and so on?
Yeah, definitely. I think that it sounds like there's a lot of crossover between how you might conceptualize it and work with it in the compassion focused therapy and schema therapy, definitely. And I guess in schema therapy, we like Lars mentioned, certainly, in the beginning, early stages, you spend a lot of time reparenting, like being the person connecting with the vulnerability to demonstrate compassion to that child mode, trying to help people access that. And then it's like I guess over time it's more like a handover to their, when they're more able to delimit some of those critics and be able to kind of take the reins of the compassion, that they can then transfer that. And really that's where you get a lot of the progress from, where they're able, where there's a motivation and a willingness to want to be compassionate to the parts of themselves they never have been before, for lots of reasons. And I think the more traumatized people are, and the more that self-loathing, I think, is a big one. People that have lots of self-loathing, I in my experience find that the hardest to do. But when they're able to, you can see real change, that it translates into behavioral change as well, doing things differently.
I would say that so I'm curious, like with the CFT, there's we think, is it so that you would think about like someone's shame part, someone's critical part, someone's depressed part? Is that how it would be viewed? Is it like?
Yeah, so we'll often we might start with the big three, which might be the angry self, the anxious self, the sad self, and we're exploring those from the point of view of them arising from the threat system, I guess. So with CFT, we also have that kind of evolutionary based notion of the evolved human brain and the different systems that are at play, the threat system being the kind of fight, flight, freeze, appease system, and the drive system being more about striving and wanting and obtaining and succeeding, and the soothing system, which is sort of a little bit more about connection and caring and feeling safe and secure, which is, so there's definitely crossover there, isn't there, in terms of some of the schema therapy model. And then we might try to sort of bring the compassionate self to the anxious self, the angry self, the sad self, understanding the motivations behind those parts. And then, sort of moving towards perhaps the critical self, and maybe even the shamed self, and bringing compassion to all of that.
Yeah, and just as you're talking, Sam, I'm thinking, like a lot, the fight, flight, or freeze mode, defense kind of, that's one of them, right? That the modes will track onto that for very nicely, in terms of, we've got, a part that just kind of avoidant modes, which is just around sort of not feeling stuff, blocking down feelings, freezing, surrendering to the mode, to the schema. In some cases, so there's a mode that kind of captures that sense of freezing and just giving up and just being as small as possible. And there's a mode that, or sequence of modes that kind of capture that sort of avoidance, and then a sequence of modes that captures that sense of fighting back, or pushing back, or lashing out kind of thing as well. So, and in fact, it's interesting, as you're talking, like I could see that actually a lot of these modes would track onto to that model as well.
Yes,
it's sort different names, right? So
yes, it's interesting, really, isn't it? Because CFT, schema therapy, probably others as well, are starting to move in that direction of this idea of multiplicity and different parts, and certain parts that are more likely to cause harm or suffering, rather than other parts that might kind of bring compassion. But Shay, one of the things I've wondered about is whether there's kind of like compassion itself is healthy adult mode, or whether healthy adult mode is actually a bit broader than that, that healthy adult mode might come in a variety of ways depending on the situation. I mean, obviously compassion is a sensitivity to suffering and a sort of a commitment to try to alleviate or prevent that suffering. But maybe that is healthy adult mode, or it's broader. What would you say about that?
Yeah, look, I think the compassion kind of stuff and what you're describing definitely is healthy adult. But I think, healthy adult possibly is a broader concept in that, because I guess the examples that come to mind when I think about working with forensic clients who have a lot of overcompensating modes. So these are the ones that are people who are hostile, aggressive, want to sort of dominate and dictate, threaten, that kind of stuff. So one of the unmet needs, often there's a lot of things going on there, but one of the common ones is also just like they just haven't had appropriate limits placed on them. So they don't actually know how to put limits on their behavior interpersonally. Part of a healthy adult mode, when you're, I guess you're trying to model that, as a reparenting someone, is putting limits on someone's behavior, often in the room. So when you have a client that is behaving towards you in an overcompensating way, so there might be, it might be trying to be intimidating or dictate terms or whatever it is, even threatening sometimes. I guess part of it's that you're trying to model that kind of healthy adult stuff by putting limits on it. And I guess that is driven by a motivation of compassion, of course, because it's actually in their interests. But it's not, it's not particularly using compassion in order to do it. It's more of a behavioral, like you would imagine working with an unruly teenager a lot of the time.
We think, I guess, another way of thinking about it, and just as you're talking, Shay, and the question, Sam, which I think has made me think about it slightly differently. I think with a healthy adult, what we'd say is, like, the healthy adult, when it's well developed in a client, in you as a person, then you're able to get your emotional needs met in your life, for autonomy, for connection, for expressing yourself, for spontaneity, for play, for being able to have realistic limits and self-control. So I think the healthy adult would conceptualize psychological, emotional skills that kind of allow a person to navigate their life in ways that helps them sort of do that in a way that doesn't harm themselves, right? So it's healthy because it doesn't go out and just kind of bully and dominate everybody else to get my needs met, because that's not healthy, right? Like, and you have lots of problems with other things. But I would think that's what we try to model with the clients. It's not just being compassionate to yourself and that, but it's being able to kind of, I guess, navigate these things in a way that is practical and effective, and healthy, as defined by the fact that you feel that you're not troubled by the schemas, and that you're able to get your needs met in your relationships in your life in ways that that work in the longer term.
Yes, it's got the healthy adult mode has a close eye on sort of health and well-being, I guess, in a general sense, and that the things that the healthy adult might sort of think or do or say and so on are really in the service of that, I suppose. I mean, an interesting one of the needs would be, or I think there might be two needs, the spontaneity and the play, for example. Like that's interesting, isn't it? Because it's still got a kind of compassionate motivation, because you're wanting to suffer less and perhaps flourish more, but it's also got a sort of drive system piece, which is about kind of feeling activated a bit, or kind of being able to engage with those sorts of aspects of one's life.
Like spontaneity, play, joy.
Yes. Yeah,
Absolutely.
exactly.
We know with people, I guess, who don't have that need met very well, one of the, might be through having an unrelenting standards schema, for example, where perhaps they grew up in an environment where achievement was just prized and reinforced over everything. Then they often believe that, play and spontaneity is quite frivolous and pointless, and, and so they have this critical parent mode kick in to squash that, that's, and often have an overcompensating mode of sort of an over controller mode, which, the unrelenting standards is driving that, because they can never switch off. Actually, quite the opposite of spontaneity and play is that they're always, so they might be the workaholics, people that are like, everything is about achievement and seriousness, and, so somebody who perhaps may not, who might function like that, you would see probably didn't have their needs met for that when they were younger, that it's actually okay just to, just to actually relax, enjoy yourself, to have fun. That's actually a need that people have, and that when you're doing that, it's not about being lazy or frivolous or, meaningless, I guess.
Yeah. It's interesting. It sort of brings to mind some of the I guess the basics of behavioral theory, that there are certain things that we learn through associative learning early on. Certain things become conditioned. So if the person who's meant to care for us is also harming us, then the caring system gets kind of conditioned to, respond in a threat system activation. But then also operant conditioning's in the mix too. Like if every time you try to sort of be spontaneous or play and that gets punished, then you quickly learn, not to be spontaneous or play. Everything has to be very serious. So it's sort of always interests me how, those age-old behavioral theories are just so powerful in the development around the needs, the unmet needs, the emotional wounds.
I think one of the interesting things when you're working with clients is how I always think about, or talk with my clients about, how insidious schemas are, because until you really start to get to grips with your own profile and how they operate, it's actually really hard for people to see them. So a lot of clients often mistake what is the over controller mode, because that's all about achievement and discipline and doing well, which is, rewarded a lot in our society. They mistake that for the healthy adult. They think that is healthy adult, and that's what gets them, the good things in life, but with the exception that, that they, can recognize that it's exhausting. You can never, what I mean? It's just wears people out. But it's interesting that it takes, in schema therapy, it often takes quite some time for people to be able to even recognize, that perhaps what they've relied on, or what they felt was a positive aspect to them, part of them, in fact, might well be a coping mode.
Yes, there's sort of like identification, differentiation, reintegration. Like there's these phases, isn't there, where we're trying to work with the schemas and the modes to kind of get that clarity. Of course, in CFT, Paul Gilbert really identified fears of compassion, fears of self-compassion, and also the way that we feel very attached to, for example, self-criticism, even thinking that self-criticism works and helps to keep us motivated, or stops us getting lax or lazy, or if I criticize myself, then no one else can criticize me and hurt me as bad as I can. There's some sort of function there, and people are often fearful of losing something like self-criticism and fearful of what the implications might be of being more self-compassionate.
Yeah, look, I completely. I mean, that's not what you're describing there. I mean, I'm not familiar with that, but I can definitely relate that to clients in schema therapy, where they vehemently believe, cling on to it for grim death, that the critical parent is a motivator. That that they see that this is a positive thing, and that this, being sort of unrelenting in how they approach things is actually how they're going to get successful in life. And you can't give that up. They're terrified to tinker with any of that kind of stuff, but then, one of the reasons they're presenting for therapy is they're on the verge of they can't continue the pattern that they've been doing. They're exhausted. They're, about to fall over. So,
yeah, I think that I guess one of the things that we would look at that kind of a presentation or that kind of description as be thinking, okay, so this is some kind of mode that the person has, and it could be different kinds of modes. So it might be a demanding parent mode. So this is we kind of hypothesize this would be the internalized experience of a demanding parent, or a situation that happened when they were growing up that's just been internalized and then just becomes, sort of like white noise in the background. And for some clients, I mean, I know that there's a bit of debate that maybe the demanding parent mode isn't necessarily as I mean, previously, early on, perhaps we might have thought, okay, we've got to really turn that down because it's just a bad thing, and all this kind of stuff. But for some people, I think when we look at this demand, so there's the demanding parent mode, which manifests for folks as in the shoulds and the musts. I should be doing this. I must be doing better. And then there's the critical punitive part of them, which is much more personal and abusive, and you're not worth anything. You're worthless. So it's just, it's damaging and hard and awful. It feels awful. So it feels like emotionally very different for people when they have these two different parts of them that might be activated. With the demanding parent, there is in some situations a circumstance we think back, right, where this might have been useful, right? It might have been useful to have a bit of an internalized demanding side of you if you're growing up in a home environment where there's just chaos and no one is really looking out for you or helping you, right? So I certainly know with clients who have a very big demanding parent mode, they often are they sometimes might be growing up in environments where, parents were just very apathetic. They just didn't care. They just didn't ensure that they were. So they almost kind of developed this coping mode as a way of just trying to get themselves out the door and making sure that they actually went to school and got themselves organized and things like that. And then obviously what happens is that, okay, so, you are, as an adult now, you probably don't need that mode so much. You probably don't need that on 10 out of 10 all the time. So that's sometimes, I guess, where we can look at that kind of experience for someone and think, okay, what's really going on here? So it maybe was helpful one time, but not so much now.
Yeah, we sort of, I sometimes, that reminds me of the critical self, that there might be different forms of self-criticism. There might be self-criticism that is very much shame-based, self-hating self-criticism, which sounds much more maybe like the very punitive critical parent. And then there might be something that's perhaps more constructive or self-improving self-criticism, which is where we are able to identify the bits that aren't working so well in our life and kind of critique them and move towards improvement. So it's hard. We're sort of not wanting to throw the baby out with the bathwater, so to speak, I suppose. There might be elements even of our coping modes, maybe not when it's on a 10 out of 10 register, but that there might even be elements of some of those coping modes that are worth keeping.
I think they keep people safe, don't they? I mean, the reason people use the coping mode is they keep them safe, and it's, I guess, the the degree that the mode shows up, I think, is commensurate to the degree of the lack of safety sometimes people have. I think when folks go back into,
I think that's where, if you're talking about safety, because it might be,
yeah,
it might not be safety, that
that's
might
true.
be something else, right?
But with safety, I do think there's maybe merit to that stand, that it's kind of, if you get people that all this stuff is, seeded from their developmental environment, and you get people that continue to have to engage with those characters in their lives, or those people in their lives, that, it's going back, dealing with that there is, it's the part of them that kept them safe, so there's aspects to that.
I think also certainly when I talk with clients and we do therapy around the modes, it's like it's always going to be there. Like at the end of the day, we think about modes as they, at one stage they were helpful, and a way to think about modes is like they come about when people are usually very young. So it's like it's a young person's attempt to try to solve a problem that they're confronting, and in some cases, like just going numb and just disconnecting from your feelings. Nowadays, probably not a good idea, but back then, when you're 8 or 9 and there's no one there and you just got to get through, like maybe that is the best way of dealing with a terrifying situation. So you can see that, but the problem is when we have that way of coping with problems, anything that reminds us of it, across the board over time, and that's where the problems, I guess, start to kind of manifest, because it becomes relied on too much, too often, and to the detriment of the person's ability to connect with other people and themselves, and so on and so forth. So I would say that always the modes always stay with you. They're always in the background, perhaps, and sometimes they're not. Instead of being 10 out of 10, they can be 2 out of 10. The skill is to be able to learn how to step in and reassure that mode and say, hey, it's all right, I got this. You don't need to be so big. It's not so scary. I can deal with it okay. So as to be able to kind of, reassure that part of themselves, or soothe themselves, so that they're able to kind of be in a much more effective space. And
Quick question before then I'll move on to a different question. But are schemas by definition sort of considered maladaptive, or are there schemas that we develop that are also, like, for example, sometimes I wonder whether certain values that we hold are kind of also like schemas, but in the sort of adaptive category, or is that just kind of way off base when it comes to the theory?
Well, in schema therapy, we obviously focus on the negative maladaptive ones, right?
Yes.
The maladaptive schemas. But there is some research now starting to come out. I know that in the last conference I was with last year, there was someone giving a presentation on positive schemas. I know that researchers in Europe are sort of looking a little bit more at what does what are the healthy adults kind of positive schemas or modes that we can identify and recognize. It feels very familiar to a lot of the values-driven stuff from ACT and other kinds of therapy that uses that kind of stuff as well.
I think sometimes
I would think that absolutely there is,
I
think that's what we're trying to do, isn't it? With a healthy adult mode, we're trying to develop a broad, flexible schema model for being able to engage with the world effectively.
Yeah, it's a really good point though, because I mean, obviously in therapy, people come to therapy because something's wrong, and they're trying to get things right in a sense, in a very basic way. But I always think, like, when we, sort of use the schema questionnaire, to get someone's profile, that you're obviously looking at the spikes in the profile in terms of saying, okay, here's their schema profile, making sense of that, etc. But there's about 18 different schemas on that, the one that Jeffrey Young developed. But so I always think of it like, if there's an absence of problem with a lot of the schemas that he's trying to measure on there, that you probably can think they're likely strengths or positives, which perhaps maybe positive schemas necessarily call them that, but I think of it in that way. So failure is one of the early maladaptive schemas. You know, if someone's got high scores on that, obviously they have issues around failure, which you'll be able to track out in their childhood experiences. But if somebody doesn't have that, like if someone scores very low on failure, then you could probably anticipate that a positive kind of schema they have of themselves is of being capable of success, being competent. But it's a really good point, because we don't it's not probably about it. We don't really formulate and conceptualize it in the same way as we do the maladaptive ones. And it might be actually very helpful to do that, to be honest. It's a good thought.
You mentioned before that, and this is what I'd like to get onto next, is a little bit of a sense of how the schema therapy might look, when we're doing perhaps some of the strategies and so on. But you mentioned before that notion of the limited reparenting and the modeling, in effect, of compassion and compassion for the person, and that gradually they pick up on that as well. But I wonder whether there is a sort of a guided discovery piece where we're actually tapping into those strengths, into those positive schemas that the person already has, perhaps somewhere in there, and that they can be brought to the surface and brought to this healthy adult mode and to that compassion that they might direct to themselves.
Absolutely. I think early on, when you start working with someone using schema therapy, you often get a sense of just how well developed their healthy adult mode is, and how well developed they are of being able to be self-reflective, and also be able to articulate and talk about their different reactions without getting consumed by the modes that might get activated. So they can sort of perhaps sit there and say, yeah, I know I have this side of me that just goes numb, and I don't know why. And, when I get out of it, I just kind of recognize, geez, I don't know what's going on there. Or I have a part of me that just gets really angry and just can't, just pushes back and argumentative with people, right? So you can start to kind of talk to the person about, okay, so there's a part of you that, so they can have this sense that this just doesn't work and it's not quite effective. That's kind of healthy, right? It's kind of healthy that you can reflect this, so we can look at it. And then we look at, well, what's the trigger to this? What's underlying this? What's the schema that this might be linked to? And what's the vulnerable child mode, right, where you feel the pain? And in many cases, when you do this, the experiential work, because we use a lot of experiential work, we will do that in either using Gestalt-like chair work or with imagery work. And we will often do that with the traumatized part of them, or the child mode that feels this pain. And our engagement with that part of them is trying to respond or react to the traumatized part in a way that that heals them, or gives them what they didn't get back then that led to this trauma. And over time, what you try to do is you might, as a therapist, you model this, you give this in the imagery, you do it in the chair work, you engage with the client in this way, but you start to try to incorporate the client's healthy adult mode into those exercises as well. So what does that look like? So that might look like, if we're doing imagery with a client's vulnerable, traumatized part, right, 7-year-old part, this is the memory that comes up. We might step into the image and be protective and nurturing. And then we might, if the client is strong enough to do it, have the client also in the imagery, the healthy adult, step into that and then offer comfort to themselves, to their vulnerable part. Right. And then over time, what you would see is that you, as a therapist, start to step back further and allow the client to start to sort of comfort and reassure themselves, or the traumatized part over time. And with clients who come in who have a healthy adult, a side of themselves, a part of them that's well developed, they can start doing that very early on. But a lot of clients that we work with, in many cases, have a very small healthy adult mode and very big avoidant modes and overcompensating modes, and often in therapy, that's what you're dealing with for a lot of the time. You're working with these modes that feel so powerful and overwhelming for the client, and also for you in the session. but you have to be able, but get activated, because behind them is this trauma. Behind them is this traumatized part of them that just really feels feels distress. And these modes exist obviously to keep him safe or her safe.
Yeah. Yes, I really appreciate it. I think this is right. I might be showing my ignorance, but there's a sort of a schema identification phase that might use some of those sorts of strategies to really sort of identify that and use the questionnaire, but also some imagery exercises and so on, and creating that kind of awareness of one's own mind and developing a sense of the modes that might be at play, helping to cope with those wounds. And then there might be a schema or mode change phase, I guess, where you might still be using imagery, but now the therapist is coming into the imagery, or the person's own healthy adult might be coming into the imagery. Schema flashcards, I think, which I always find make a lot of sense to try to take that experience of the experiential exercise in session out into the world, I suppose, but then also the chair work as a way to really start to kind of practice. Are those some of the things that you might be doing along the way to work with all of this?
Stan, have you been doing schema therapy?
Have you done the training, Stan?
I did the training
nailed.
with Jeffrey Young about,
Oh, there you go.
I think it was 2007. That's why I'm just checking with you, because it's been a while. But no, and the thing, of course, is that some of those bits. I mean, definitely imagery, definitely chair work, certainly behavioral strategies. Those are all big parts of CFT as well. It's sort of similar stuff that we might use there.
Yeah. I wanted to kind of circle back to this concept of you like highlighting, I guess, the strengths of the, which is the healthy adult mode. I guess working with forensic clients predominantly, and some of them really, have extreme problems. So working with, people who are incarcerated or prisoners on dangerous offenders orders and things like that. So it's really, I think, important to really emphasize that. It can be hard to find sometimes too with people, but it's important because those men in those environments never have that stuff reflected to them. They're not living in environments or by the very nature of the things they've done, very rarely would they get feedback from anybody that there's actually very much positive about them at all. So it makes it difficult for them to perhaps even identify aspects of their healthy adult mode, because they're in, living in environments that require them often to be, hyper vigilant about, just surviving.
Yes.
And often the focus is on offending behavior. So they're taken back constantly to that, because that's the focus of being in jail or being in a forensic treatment sort of situation. So it can be, and when they have a really, that's something they've been in a system like that for a long time. They're the touch points around how many times they might have ever had anybody focus on the positives, or actually the part of themselves that makes good decisions, that can be kind to people, can do the right thing, is often very small. So it can that stuff can take quite a long time, to develop, or get them to even focus on a sense of themselves that, that stuff is all in there, let alone have it be the biggest part of, how you want them to function.
It really is a sort of a continuing to unfold tragedy for them, isn't it? Because the emotional wounds keep coming.
Yeah, and they get labelled as this or that, and like a global thing very often. I mean, the media does it, stigmatized, all of that kind of stuff. But I think the thing I love about schema therapy is the language of the sides or the parts, is that, there was a side of you that did that to that person. They might have raped someone, or they might have, done something very bad. But there's actually, you can recognize there is another side of them that, takes care of their mum. There is another side of them that does this, that does that other people might not recognize. So you really, it's helpful to really differentiate the different parts, to be able to, and especially if someone has a bit of a as everybody does, has a blowout or a bit of a relapse where, these overcompensating parts might come back to the fore, so they may behave aggressively, or they might, do something, violent even. I guess being able to kind of, differentiate between that and the healthy adult. So what went wrong there? What prevented you from accessing that healthy adult part? Because we know you've got one.
And I can really hear the sort of the compassionate motivation of the therapist there, being able to, kind of really stay tuned to that and know that even some of the really abhorrent parts of this, what this person might have done and so on, that so much of it is not their fault, given what we know about their early life and their unmet needs and their kind of emotional wounds, and this was them as a 7-year-old, and so being able to kind of tap into that, it's not your fault, but it is your responsibility. Like, what do we do from here? How do we now move forward with this knowledge and sort of help you change or help you start to treat yourself with more compassion?
And incorporate the healthy adult as part of their identity, because a lot of times with really antisocial men, that's not necessarily how they see themselves, so trying to really help them integrate that part and sort of broaden it and see it as a useful, functional part, where that's not often been their story a lot of the time.
I think also,
Lars, could you give us a maybe like an example of someone in the forensic system and maybe a sense of, like what sorts of modes might be at play there, or, and what might be the chipping away that one might do to move forward?
So the way we make sense of criminal activity or violence, usually in schema therapy, is that in many cases it's a function of the modes that are active for someone, and usually those modes get activated because there's been some sort of schema reaction, trauma reaction that maybe has activated their vulnerable child, which then kind of kicks into play some of their coping modes. So in schema therapy, in the forensic context, it's overcompensating modes that often are the most dominant and prevalent. So these are the modes where we have, I think, 5 or 6, overcompensating modes which are common. So there's a conning manipulator mode, which is a mode which is very much around using deception and deceit as a way of being able to exploit situations to get your needs met. There is a self-aggrandizer kind of mode, which is a very common mode within the forensic context. It's this mode where it's like, I'm top dog, I'm the one on top, I'm better, I'm good at fighting, I'm good at this, I'm good at that. I think antisocial clients who have a diagnosis of antisocial personality disorder invariably always have this self-aggrandizer mode, and you don't have to look very hard to see it. When I worked for over 10 years within a maximum security unit, doing assessments on risk of violence assessments on guys that were in there, and one of the questions I always asked them was, "Are you good at fighting?" And every one of them was, "Oh yeah, I'm feared." I'm feared in the prison. They're like all these people that I'm so good, I'm the best. People are lining up outside to get me into a boxing career. I'd ask that question for a number of reasons. One is to kind of try to assess attitudes around violence and expectations around that. But it was always funny after a while, because they all reveled in telling me how powerful and wonderful they were. Their self-aggrandizer mode. And there's a couple of other ones and these are the ones which often are related to violence. So bully and attack mode, which is around using intimidation and violence, not just physical violence, but also psychological violence as a way of getting their needs met. There's a predator mode, which is I like the bully and attack mode, but it's much more cold and it's focused more on just actually destroying people, hurting people, getting rid of people. And then there's a suspicious and paranoid over controller mode, which is like a hypervigilant mode. In prison environments, forensic contexts, you will see the suspicious, paranoid, over controller mode. They notice everything. They see everything. They keep grudges. They notice when someone disrespects them or something like that. They're always on the lookout for danger and threat and disrespect, and ready to attack or deal with it as quickly as possible. So a lot of the time, that's what you're working with. So when you see clients, when we see clients for the first time, we're working with a lot of these overcompensating modes in our session. And I should also say that the other really big modes in our clientele is what we call the detach protector mode and the detach self-soother. So the detach protector mode is that, and we've all seen it, like if you've ever done therapy, it with anyone over a long period of time, everyone's got a bit of a detach protector mode, because it's that mode where you just go, oh, yeah, I'm not feeling anything. Nothing's going on. No, it's all good, sweet,
whatever.
So it's that kind of mode that you see a lot of the time. They come into the session and they're in this stuck, disconnected, unfeeling, detached mode, or they will flip into in some of these overcompensating modes, notably the self-aggrandizer, obviously, I told you about before, and the conning and manipulator mode, which is like, oh my God, this is the best therapy I've ever had. You're the best therapist that I've ever had. No one understands me
You're
quite
different
like
to
you
all
do,
the other ones
Stan.
I've ever seen.
Like, I know you've only seen me for 20 minutes, but I feel like you're the one.
Right? I usually just take that on board.
I know, it's nice, isn't it? It's nice, yeah. You are the one. Really? Yeah. 20
so
minutes.
special.
I think that's it. I'm done. I'm good.
Yeah.
So we see it.
And in the forensic space, though, you have to be good at tolerating anger. There's a lot of anger. So angry child modes, enraged child modes, angry protector, bully and attack, they all have anger in them, so, and you have to be good at assessing it, I guess. So you've got to figure out what's the risk here and how's this working in terms of keeping yourself safe, and especially when you're working with people who have a high propensity for that, but you have to be able to tolerate people being hostile and angry and not necessarily liking you. It's not about that. They treat you with suspicion and actually being overly warm towards people.
And this is another
it
thing.
garners suspicion because their mistrust and abuse schema gets triggered like that, and they're just thinking, well, what are you trying? What angle are you coming at here? What do you want from me? They don't see it for the intention that you might be giving it. So with forensic clients who have a long history of violence or incarceration, going in really warm and compassionate is likely to be counterproductive initially, because they just, they don't see it the way that other types of clients might view that as, oh, that's just exactly what I need. This beautiful man who's therapist who's so warm and compassionate and lovely. That, a lot of forensic clients are immediately put off by that, and you end up having a whole lot of other stuff come into the room because their coping modes kick in very quickly because they're trying to figure out what's your angle.
Well, people are threats, I guess, aren't they? So the threat system's activated. Anger is there as part of all of that, and it's a kind of it reminds me of the social rank theory idea, that people are vying for status there, and trying to use dominance, I guess, primarily as their way. Maybe a little bit of competence or prestige in terms of, I'm the best fighter or whatever, but also it's that kind of dominance approach to trying to feel safe in the group, and not feel at the bottom, where they would then once again feel vulnerable, and their vulnerable child is exposed.
And the thing about climbing that hierarchy is that, the higher you climb it, right, the more you have to fall, and also the bigger the target you have. So it's like, grudges are held, and slights are remembered for forever, and opportunities are taken when there's vulnerability that is shown. So a lot of clients that we work with, where you're trying to help them be different in this world, and you're really asking them to turn off these overcompensating modes, these modes that get them on top, right? They get that allow them to be in control and safe. and you ask them to turn it off because in a sense it's not good for them, and it puts them in these situations where they're violent or they hurt people or they do things. But to turn it off for them actually means that they then become vulnerable, and not just in an emotional sense, but in an actual practical reality sense.
Absolutely.
Which when you come from our world, perhaps, where there are safe people in the world, perhaps, but in that world, it's not, right. So it's a lot to ask people, and I think it's a conundrum. It's a Rubicon of sorts that that if you cross that, then they're doing well in therapy, but you also kind of don't know what's going to happen as well, or what could happen to them. Which
yes.
I have to say it, Lars, context is king.
Yes.
One of my sayings is like, when you're working with that, is trying to help them be vulnerable, connect to their vulnerability is the core goal of therapy, right? But when you're asking people who live in violent environments to do that, you actually have to, it's a very difficult thing for people to balance,
So Shay, how do you maintain your compassionate motivation? Like how does the therapist, in working with these populations where there is a lot of heat there, isn't there, in terms of emotionally and behaviorally and so on? I mean, what I'm just sort of interested to hear about that. Like how do you
on a very practical level, I think you have to have good supervision and peer supervision to do it, because I mean, I don't think anybody could, should, would ever, practice completely solely on their own, and because I think it's so difficult. But it is tough. I mean, I know my own, you have to know your own vulnerabilities and your own sensitivities well, I think, and know that there's certain flavors or modes that will present to you, that might trigger your own, your own schemas, your own modes. And so you've got to be sort of on top of that, all the time. But maintaining, compassion for people, I guess, is always understanding the model and applying that to people, and thinking it's always because there's this vulnerable child that didn't get the needs met. And behind all of the modes, and even ones that can be very hostile and provocative, and I've definitely had that, that's what's happening, and so we had a training by a great Dutch schema therapist called Marjon Nador. So she's from the Netherlands, and she deals with narcissistic presentation. So that's her sort of expertise. And that, I would say, also for me, is really tough sometimes when people are really narcissistic in the room and they're self-aggrandizer, and they're, is really the majority of what you get. It's very hard to feel compassion for that, because it's unpleasant, right? But remembering that behind that is a very fragile child that didn't get what they needed, is important. But Mahjong, one of her strategies was to get them to bring a picture in of when they were a child, and she would keep that. She would put that in the file, and she would have it in the session. So it helped her. And I think, and I've used that technique definitely, where you look at that and you think that that's really the core of what we're dealing with here. And it's very easy then to feel compassion, because no young child of that age, should have, they suffered things that they shouldn't have suffered.
Yeah.
So
that's
a
child once too.
Yeah. Yeah. And so that I don't know, for me, those are sort of my ways of trying to kind of deal with it. But I mean, I think everyone also has limits too. I sometimes deal with people who in the room are really, there's a fine line between people, being intimidating and people actually being threatening, right? And you're a human being as well too, and so as a schema therapist, this empathic confrontation is actually one of our techniques that we use with a lot of these overcompensating modes, and that is about, you really inject yourself more into the equation perhaps than the average therapist would, by saying, listen, when you behave like this, it's about putting limits on things. You're saying, I'm a person too, and it's not okay with me. Like, I deserve to feel safe, and I deserve to, whatever. And I'm a human being, and that's not okay. We got to, I understand what's going on for you, but I'm also in the room too. We have to both have respect for our boundaries and safety, So you're trying to foster, I guess, compassion in the patient or in the client for you as a human being, and that's a powerful thing. If you can get that happening in the room and you can get that to work, you can get people to respond to that. I think that makes a very powerful therapeutic dynamic.
Yes. Yeah. And it's it's kind of like the self-awareness of the therapist is a bit important there, and even bringing the model to oneself and being aware of one's own schemas and modes, I guess, and where they get activated and how to move through that yourself, remaining present with the client. Yes, it's quite a task, really.
Yeah. It is.
I think for the way I mean, I've probably over the years struggled with I think sometimes always feeling completely compassionate with with the work, because it can be really, really challenging, very demanding, and sometimes feel really quite unsatisfying because of the grinding nature of it, and it can feel like it's a bit of a grind. It's like rinse and repeat, and that's all we do. That's sometimes how it's felt. But I have over the years started to, for me, like I started to think about it differently in terms of the journey that the therapeutic journey that people are on. And this is both for the clinical clients and for forensic clients I have, where, the hero's journey, right? The archetypal story, Joseph Campbell. And that story, that narrative really resonates very deeply for me, because I kind of see therapy a little bit like a hero's journey, where I'm not the hero, obviously, on the journey, but it's the client that's on their journey. And so if you know the hero's journey, it's this archetypal story, that narrative that Star Wars was written in alignment with it. Lord of the Rings, there's a hero that goes out on a quest and has to confront all these obstacles along the way, and has to confront their deepest fears to then get out the other side, to have treasure and meaning, and come back to his real life and be a better person, right? So that's my sort of dumbed down version of the hero's journey. But I kind of have started to very consciously think about it like that, where that's their journey that they're on, and I'm there to help them kind of navigate their darkest moments in many cases, in the best way possible, to help them get through it. And with the view that it's a journey that they're on, and they and part of that journey, just like in Hero's Journey from Joseph Campbell, and in Star Wars, where we saw it, like the protagonist in it, the hero in it, rejects the journey, doesn't want it, wants to go back, feels like a failure. Remember Luke Skywalker and Yoda didn't want to do it, was failing all the time, wanted to go back home. But he had to push through to become Luke Skywalker, right? And to save the universe. And it sounds kitsch, but for me, I kind of, it feels easier for me to do this work when I think of it in that kind of context, even though it might feel very grandiose. But it kind of feels like, well, yeah, this kind of makes sense to me, and I can see where they are at, and I can see, where this fits into a larger narrative.
I like that. I feel that it's a moving way to think about it, and it reminds us that so many of our clients really are on a hero's journey, and quite often courage is the key, isn't it? And that we have to that takes a lot of courage to persist and face those very kind of difficult parts that are causing us and others harm, those really difficult parts that make us feel so vulnerable. It takes a lot of strength and courage and persistence, and often, perhaps a helpful guide. I don't know whether you see yourself more as the Obi-Wan Kenobi type character or Gandalf, but
what about the the elf princess? There's always hope.
Galadriel. Yeah.
Well, I always think about that, because I guess, having had the benefit of being, the age that we all are, we've all worked for a long time, and even with some of the most difficult clients I've ever worked with, where I've felt at times, oh my word, this is just like, maybe this is beyond me, maybe this is too hard for everybody. I guess with hindsight, having worked with some folks for a very long time, and taking the time to reflect on that journey and think, wow, look at where we started and look at where we are, is really beneficial. And it helps, I think, if you get new clients and you're on a very difficult path with them, it helps to kind of, for me personally, to reflect upon some of those other journeys of clients that you've been with, to think, well, this is just where you're at with them, and it is possible. Like, there is always hope. That kind of
there is always
hope.
Well, yes, that's a great line.
Well, of course,
it's always part of my healthy adult. There is always hope, right?
Well, the true hero in Star Wars, of course, was Anakin, and it was Luke that believed that there is still good in you. I can feel it.
That's right.
So,
That's
and
right.
it's a privilege, isn't it, to be sort of allowed in or invited in or a part of that journey with somebody, some of the worst times of their life, and they are willing to have you there and trying to be helpful.
And with some of our serious offenders as well, Stan, I guess I can honestly say that, it's it can be a little bit magical sometimes, where you can have people who have, done quite heinous things and, perpetrated extreme harm on people, spent a long time in custody, and then have been out for a long period of time. And actually, you can genuinely see that this person, who perhaps was written off, considered intractable, considered literally impossible to change, and that's all written and documented about them, that, you go 20 years down the track, and in fact, it's a different story, and that's a powerful thing, because even someone who's had such a compromised life and had such difficulty managing, having very little healthy adult, can transform into being, sort of transforming their modes, or into something different, I guess, or their healthy adult.
Yes.
And that's quite a powerful thing for me to reflect on sometimes. I think when I'm working with people who I just sometimes think, oh wow, is this like is this actually ever going to go anywhere here?
One of my other sayings is shift happens.
Shift happens. Oh, I like that. I've never heard of that.
Sounds like a t-shirt, Stan.
You could put that on the back of your t-shirt.
Shift happens.
Yeah. Shay and Lars, it's been wonderful to chat. I wondered, you have a number of things on. You have your own podcast, which I have been binge listening to. I think it's maybe 4 episodes so far. Is it, or 5? You also have a course that you've developed, and there is the artworks as well, which I adore. So yeah, what are some of the projects? Give us a bit of an idea of what's happening at the moment for you.
Yeah. Okay. So yeah, we do a podcast called Beyond the Crime, a psychological analysis. The psychological analysis. We do that with Rob Brockman from Sydney, who, and that's a podcast that's primarily about schema therapy with forensic clients and issues. And we've just had our first season. We're about to finish up next week, I think, our first 6 episodes. And we try to take issues in the news and particular kinds of problems, like as in offences or issues, and try to kind of dissect it using schema therapy, both from our experience, Shay and I's experience mainly, and trying to apply, well, if we're looking, so for instance, if we're looking at a case, a big case that's come up in the media or something like that, trying to make sense of it, what would we expect to see in a client if they were presenting, and we're thinking about schema therapy and working with them using schema therapy, that kind of thing. Yeah, so that's our podcast. And we also, we have an online training program. We have 2, just one for forensic schema therapy, a level 1 kind of thing, and then a hero's journey, which is our most recent one. And our hero's journey is what we've tried to do with that is do the training over a 6-week period, and have it from beginning, middle, and end in schema therapy with a forensic client. And what we've tried to do is, rather than just kind of lecture and talk about this technique or that technique or this is how you do it, we've tried to we split it up so that each session involves, like Shay in this case, analyzing what's about to happen, providing a very detailed forensic analysis, and then me doing the therapy with the client, and then we follow that all along until the end of therapy with that client.
So Lars is probably understating that one a little bit. He's amazing in it. Like, so we got an actor to come on board to do this. Mirko, who's amazing, runs one of the drama schools in town, and he acts as the forensic client. And the client's like based on a real case, so it's very, so it's very realistic what you see in it, but it's really, really gritty in terms of it's like a noir. It's black and white with the red chair. So it's visually very, and I think the feedback that we've had from a lot of people who've done it is that they really valued the fact that it's just like watching actual therapy rather than talking about it. And my part for it is narrating what's going to happen and then giving I guess an analysis or a breakdown of explaining why Lars did certain things at a certain time, or why he didn't, or what he's trying to achieve, and trying to help people be able to kind of look at that and understand it through the forensic schema therapy lens. So we're really excited to make that training, because it's a little bit unique, kind of not like your average training.
No, and it has a really, what's the word? A really powerful aesthetic. I agree. The black and white look, and the Lars's face in half shadow on the advertising thing, and
so it's designed to sort of be a little bit catching in that way, but also reflect, when you work in high secure environments and you work with people who those are your clients, and it's very reflective of that actual environment, because I think a lot of training, naturally that, forensic psychology, I guess, is a smaller subset, so, and a lot of the training certainly that you get or that you might attend doesn't really reflect the nature of that. So we wanted, because that's the sort of pond we swim in, I guess, we wanted to really reflect that for people. And I guess the feedback we've had from people who work in that forensic space as well is that that's the first kind of training like that they'd ever really seen. So hopefully it's the mark.
We were able to, in it, have it so the chair work, which is the gestalt-like chair work that we use, that was the only thing that was color in the therapy sessions. So whenever we had the chair work out for doing chair work, right, it was red, right? And, that was the only color in the actual black and white image in the therapy session when we're going through it. So, of course, that was significant because, the chair was the client would then step in and be a different mode and all this kind of stuff. And that was the sort of the thread that hung through. Very Schindler's List, I guess.
We had a bit of fun making that, and actually the people that helped us do it were excellent with us, and I have a very much new respect for people who do that in front of the screen, because it was extremely hard work, I got to say. But we have also done the track plans for a number 2 training similar to that, using the same kind of actor kind of mode, just to demonstrate a different type of offender, because that training mode is with someone who is a really a violent, aggressive person. So there's obviously lots of people in our world who are offenders but don't have that presentation. So we would be trying to focus on some of the other common modes of offending in our number 2. So maybe that's for a project for next year, I think.
It's amazing stuff, and I'm just being silly when I say that it sounds like you're giving us a nice demonstration of self-aggrandizer mode. But actually
it's pride.
It is no, I know, I'm really, that was a dumb joke, but it's great stuff. And Shay, the kind of the drawings and that's the Lars
artwork,
thing,
that's all. That's all Lars. Lars is all of his artistic flair. And again, it came out of, working in this kind of pointy end of the forensic field where, schema flashcards, there's different different ones around, different brands, different people make them or whatever. But the ones that working with a lot of the clients that we work with, these dangerous offenders, they just did not resonate with the images on the cards. And so I guess we both Lars and I, kind of noticed that. And so Lars, being, Mr. Artiste, just went ahead and designed ones that just better fit. When our clients are in a self-aggrandizer mode, there's a certain feel to it that is really scary and intimidating, rather than just someone who's being a little bit uppity. So there's a real difference. So I guess we're trying to create cards that or mode cards that sort of hit that end of the spectrum. And again, the feedback we've had from our clients that we use it with is that they can immediately recognize themselves in those cards. Yep, that's me. When I've done that, that's me, definitely. And we've also sort of been able to adapt them a little bit to better meet some things like, so there's a self-aggrandizer, but when we're working with people who are like domestic violence offenders or sex offenders, there's often what we call a coercive self-aggrandizer. It's like you bend the knee to me, that kind of thing. And that's not necessary, so there's different flavors of it in the forensic kind of world. So we've been able to kind of, I guess, create sort of more tailor-made or nuanced type of versions of that.
For a lot of our clients, being able to engage them actively with art and with stories and with narratives and all this kind of stuff, it just seems to hit better in terms of, grasping what we're talking about, getting it, this kind of stuff. And with the art materials, clients a lot of the time go, oh yeah, no, that's definitely me. Yeah, I can see that, and then suddenly we have that on the table now, and then we can talk about that, and we can talk about this part of them that does this or how that works. So
the artwork is definitely all Lars's creation, but very, very handy.
Yeah, it's good to have sort of multiple ways in, isn't it, I suppose? And art and visuals are very good, especially to some people find it more or less easy to visualize or imagine, and so bringing in the artwork. So
we have a vulnerable child doll as well. We have a little baby doll that we use, and we can sit in the chair, and that people can kind of imagine them to, and I guess encouraging clients. I have actually one client who is incarcerated who's just extremely good at art, and so he's actually making his own tailor-made mode book, just exactly how it fits his issues, because he has that aptitude, and so he's been able to really integrate the theory extremely well, because he's just taken to it through that artwork, and he's spending sometimes 20 hours creating one mode for himself. So so I think it's got that amazing applicability.
Well, I'll put some links in the description to all these various resources, and if people are interested in being in touch or engaging with your work, you have a website or other places that people can be in touch?
Yes, we have a website, fcpc.co. We have an Instagram as well. We have some socials. We have an amazing lady called Rose that works for us, who is not of our generation. He manages all of those things.
And Schema Therapy online, I think I'll just get that's where...
Schema Therapy Training Online.
Schema Therapy Training Online.
Online is where you find the training programs. Yeah, that's a separate website.
I might get you just to send me a list of the key things, and I can
we can
put them in the description. But Shay and Lars, that's been delightful. I really appreciate that conversation. Yeah, it's answered a few of the questions there about perhaps where there's overlap, but also I think some of the differences really, and some of the things that Schema Therapy bring to it all. So thank you very much for being on Compassion in a T-shirt.
Thank you very much for having us, Stan. It's wonderful.
Thank you, Stan.
Thank you.
It's been great.